Assalamu alaikum, students. Today I am having one important topic for you, and why it is important. It is relatively a pain-free condition and commonly kept in your practical exams as a short case. And second thing is you get lot of time it as a short notes in your final exams. So just to remind you again why you need to why my videos are important is they are precise, exam oriented, and very elaborative. So if you see these videos, definitely you are going to have a clear picture of orthopedics. And second thing is I'm just covering one topic every video. So if you want to see learn particular topic, you can see the videos of that topic. Uh, to start with my case, it's a 8-year-old male patient. So a patient had history of fracture 3 months back. So it's an old case of fracture. So the fracture patient had the fracture and acute phase is gone off. So patient was treated with some bandage application by coactor. Now patient is having minimal pain at the fracture site and there is restriction of movements. In addition to restriction of movement, the main complaint of patient is having deformity of the elbow joint. So this is how the patient presents here. So if you see, this is a normal elbow. If you see that this is the arm, this is the forearm, that is a normal carrying angle. Here, it's got deformed. So there is minimal pain, deformity, and limitation of movement. So this tells that fracture has united because it is pain-free, but it is united in abnormal position because patient is having deformity and limitation of movement. So that's how we define the patient case of malunion. Malunion is union is happening union of the fracture fragments of the bone, but it is happening in the faulty or abnormal position. So fracture is uniting, but uniting in abnormal position. So the fracture may unite in three abnormal position or combination of three. Angulation. So if it is straight line, it will unite in angle like this. So angulation or shortening. If there is a fracture here, it may unite with little shortening. One fragment, another fragment is moving above this one and it is uniting like this. And third is in the rotation form. The distal fragment is rotated in either outer direction or internal direction compared to the proximal. So this is how it appears. So this is angulation. The fracture is like this and the distal fragment is angulating, or there is shortening or there is rotation of the distal fragments. So these are three types of possible three planes of malunion, either angulation, shortening, or rotation. So you can have either only one or combination of these three as a presentation. So what is the clinical picture of the patient who is having malunion? So there is history of fracture. So old history of fracture will be there. And there is minimal or no pain at the fracture site. Why there is no pain? Because fracture has already healed. It passed the process of fracture healing. So there is no active inflammation. So there is no pain. Then there will be a deformity. This is the main important complaint the patient will have. They'll have deformities and change in the range of movement of the joint near to the fracture. So these are the two common complaints the patient will have. And if the fracture is affecting the lower limb, definitely patient is having some sort of limp. This limp is either due to the deformity in the leg or shortening of the leg. So how will you diagnose it? So basically it is a clinical diagnosis. As we told, there is uh, pain-free with history of fracture and deformity. Patient is relatively pain-free and there is deformity. So, what is the investigation of choice? So, as usual, you need to take an X-ray. So, X-ray always take whole length of the limb so that the amount of deformity which is clinically visible can be radiologically measured. So, always compared with the normal side. Sometimes, no, there will be little variation in the bony build of person and it varies person to person. So what exactly the control of the deformity? Better take the X-rays of the normal side. So draw the angles. So you can draw a mechanical or anatomical axis. So just remember you need to draw a lines, draw a angles. So angles and lines are important for you to quantify and locate the deformity. So this is, if you take, this is X-ray of humerus, the patient had the fracture here which united in the mal position. So when you draw a line to the bone, it should come as a straight line. But here what is happening is the fracture line got the axis is deviated like this. So this is the angle of uh, deviation. So it need to be straight like this. It has deformed. So this is an example of patient who is having malunion at the humerus. In the lower limb, how will you measure? You can measure it by drawing the lines, taking the X-ray from the pelvis till the foot. So if you point the center of the hip joint, this is hip joint center, hip joint center, then center of the knee joint. It's a knee joint center. Then the third is when you look ankle joint center. So when you draw the ankle joint, so when you draw a line from the central of the hip to center of the knee to the center of the ankle, it should pass through the center of the knee and ankle. So equally bisecting the distal condyle of tibia, femur and proximal tibia into medial and lateral half. So this is how if it moves this way or that way, it is a malunion. The second thing is when you draw a line along the two hips, two knees, and two ankles, they should be parallel. So this is how you qualify and quantify the deformity of the lower limbs. So you draw, take an X-ray of full limb, compare it to the normal side, draw angles, draw the lines. This, if you remember this much and if you tell this much in your exam, that is more than enough. Then if what happens if you not treat malunion? So the main complaint patient will be having is cosmosis. So the limb is deformed. So limbs are first exposed to part of the bodies to the surroundings. So somebody sees, they always ask, what is the problem you have? So it's a cosmetic problem. Second thing is, if the deformity is there near the neurovascular structure, there is a high chances of damage to the neurovascular bundle. So if you not treat, there is chances of patient having neurovascular deficit. And when there is alteration in the weight transmission forces due to malunion of the lower limb fractures, patient may develop pain in the knee joint because the weight transmission is deferred, and there is arthritis because the forces acting at the joint is altered. So alteration in the forces around the joints may cause pain. Later, patient will end up in arthritis. These are the reasons why you need to treat the patient who is presenting you with the malunion of the fracture. So how will you treat the malunion? So what we'll do is we'll break the bone again and we fix it in the position which we want. So it is called as corrective osteotomy. So we need to open the level of the deformity, break the bone and fix it with the proper implant. We can use either plate, screws, keyword, depending on the fracture type, age of the patient and the surgeon choice. So this is the one common definition the examiner will ask you in Viva exam. What is the definition of osteotomy? Always need to remember this terminology is very important. It is a planned. So it's a planned surgical cutting of the bone. So if you tell just breaking of the bone or cutting of the bone, they just laugh it, because breaking and cutting is it can happen either in accident or if somebody is fighting, there is chances that someone will have a break in the bone. So it's a planned surgical cutting of the bone. So this terminology planned is very important when you are answering in your Viva. So this is called as corrective osteotomy. So in when I am discussing correcting osteotomy, it's high time to tell you about two instruments we use in orthopedics. One is chisel and osteotome. Why they are important is these are kept in your exam as a uh, in instrument viva in exams. So one is chisel, one is osteotome. So how you will differentiate chisel from osteotome? So what is the use of osteotome? Osteotome is used for doing osteotomy. Chisel is used for grafting the bone. So how they differs with each other? So chisel will have only one edge beveled and it is used to chip the bone. So it is something like that. If this is so only one end is beveled, whereas in osteotome we have beveling on either side. So this is how this horizontal line, I don't know how it is coming. There is some problem in my cursor. So this is beveled on either side. It is osteotome. Beveled on only one side is a chisel. So osteotome is used to cut the bone or divide the bone, whereas the chisel is to harvest the bone. So chisel is the instrument which our carpenters use. They use to elevate the or create the designs over the bone, designs over the wood. So only one side of the wood they will be elevating it. They won't damage the other side of the, so this is the how the chisel looks. Whereas osteotomy, if you see, it is beveled on either side. And we have one more instrument called bone gauge. Bone gauge is similar to that of chisel, but it is having curved end. The end is curved. End is curved like this. So it's got uh, uh, the chisel with curved end is bone gauge. Chisel is used for elevating the bone. Whereas osteotome is having beveled on either side and used to do osteotomy. Now we use sometimes the electric bone saw. Bone saw is it's a electric assisted same osteotome like function. It same like saw. So to cut the bones. When you ask you are given osteotome as an instrument in your examination, they will ask you to tell you about the various types of various names of the osteotomies. So at least you need to remember 3 or 4 osteotomies. So one is we do modified French osteotomy. Modified French osteotomy, where we do around the elbow when patient is having cubitus varus. When patient has cubitus varus, when they have malunited supracondylar humerus fracture. So I will be telling you in detail about this when I am dealing you with supracondylar humerus fractures. But you need to just remember cubitus varus, we develop this deformity after supracondylar humerus fracture, and the treatment for this one is modified French osteotomy. What we are doing here is patient is, as you see here, patient is having varus deformity. What we are doing is we are removing the pie of bone and we are correcting the deformity. This is the bone, we are taking it out. It is something like a slice. So this is cubitus varus deformity. We are doing modified French osteotomy. I'll be telling you 3 more examples for osteotomies. This is around the distal end of the radius. It's a distal radius. What type of, this is distal radius in malunited Colles fracture. Malunited Colles fracture. Colles fracture. What osteotomy we do here? Here is Fernandez osteotomy. Fernandez osteotomy. So you need to remember one more type of osteotomy. It is called Fernandez osteotomy, used for malunited distal radius fracture. Then for non-union of intracapsular fracture, neck of femur, we do this osteotomy around the proximal femur. They goes by name Powell's osteotomy. So, and McMurray's osteotomy. So we do McMurray's osteotomy and Powell's osteotomy along the proximal femur in the patient who have fractured neck of femur. And this is called Dunn's osteotomy. Dunn's osteotomy is used for slip capital femoral epiphysis. Slip capital femoral epiphysis. Then last is Dwyer's osteotomy. D. It's D. Dwyer's osteotomy. Dwyer's osteotomy is done over the calcaneum for varus correction. So this all you need to know when you are reading the topic, that is malunion. So to summarize, malunion is a union of the bone in abnormal position. So it is a late complication of the fracture, happens mostly after 3 months. So patient will be having relatively less pain, but more problematic due to cosmosis, limited movement, and uh, there may be some neurovascular deficit if it is kept for the little longer time. So it may be around 3 in the it may be in longitudinal axis or angulation or rotation, or combination of this. The diagnosis here is by X-ray, by measuring the axis, by measuring the angles along the joint. Treatment for this one is corrective osteotomy. So corrective osteotomy is a planned cut inside in the bone to correct the deformity, and we can use any sort of fixing device for this one. So after this, you need to know the differentiation between how to differentiate chisel from osteotome. So osteotome is beveled on both sides, chisel is beveled on one side. Chisel is commonly used by carpenters. Osteotome is to break the bone. Chisel in orthopedics used to do or harvest the bone for bone grafting, and modified form of chisels is gauge. And what are the different types of osteotomies? Modified French osteotomy for cubitus varus, Fernandez osteotomies for distal and radius malunited fracture, Powell's and McMurray's osteotomy for non-union intracapsular neck of femur fracture, Dunn's osteotomy for slip capital femoral epiphysis, Dyer's osteotomy for calcaneal varus correction. So that's all about today's topic. Please subscribe, like, and share the videos, and keep on posting the reviews so that we can improve in next video. Thanks for listening. Thank you.